Belinda Foreman, student nurse, and I'm doing a demonstration video on the Ztrack method. I've just received some orders. I need to give my patient, Mr. Frankfurter, Rocephin, 1 gram intramuscularly using the Ztrack method. So, I'm going to go into the MAR and just make sure I've got the right patient, right med. And Mr. Frankfurter in room 208 needs 1 gram of Rocephin, injected intramuscularly using the Z-Fit. So right patient, right drug, right dose, right route. Alright, so the next thing I'm going to do is I'm going to go to the med room and make sure I get my medication properly prepared. Now my Rocephin is in a powder form and it needs to be diluted. So I'm going to look at the back here and see what amount of diluent that I need. And I want to do this at 5 milligrams per milliliter, or 500 milligrams per milliliter. That'll give me 1,000 milligrams for 2 milliliters, which is 1 gram. So I need to add 5.6 milliliters of diluent in order to make that math work out. So I'm going to wash my hands. And this syringe that I'm about to grab is only for diluting the medication or reconstituting the medication. Got my 10 milligram or milliliter, 10 milliliter syringe, and my 22 gauge needle. That on there. Okay. Then I'm going to clean the tops of my bottles here. My diluent is 0.9% sodium chloride. Take the cap off of this one. And I've checked all medications for expiration dates. And we are good. So, I know that I need to put 5.6 milliliters of diluent in here. So I'm going to withdraw 5.6 milliliters of air out of this medication syringe to create a little bit of a vacuum. So I have room for my diluent. I'm going to inject the air into my diluent, going in at an angle so I don't pour the top. And then I'm going to pull up .6 milliliters of the diluent. Okay. And then I'm going to go ahead and inject that diluent into my medication to reconstitute it.
Oh yeah. So I got them all done in 1 day.
Okay. Alright. So I can go ahead and get rid of that in the sharps container. Now this medication needs to be fully dissolved, and I need to roll it between my hands to mix the medication with the diluent, and I'm going to let that set a little bit. And when I go in to see the patient, I'm going to need to find my site in order to make this injection. And you might be wondering, how I would do that. Follow me.
I don't think the wheel was supposed to do that.
Well, it's
So, I patient here
kind of goes to fill up and then goes.
on the hip, and right in between these two knuckles is going to be my site, my ventrogluteal injection. Okay, so I'm going to cover her. We'll be back later. All right. For the purposes of this demonstration, we'll be doing the injection on Frank Furter. And his ventrogluteal site is a little harder to find. I'm going to, before I go into Frank's room, I need to drop the medication. So, now that our medication is reconstituted and there are no particles, everything's fully mixed, I'm going to get out my syringe that I'm going to use for the injection. I'm going to wash my hands since I did go over and my hands all over a mannequin. Remove this needle because this is the needle that I'm going to use to inject my patient. This medication is irritating, and so, which is why we're doing the Ztrack method, but we are going to withdraw it with a different. This is going to just be, the only purpose of this needle is to drop the medication. I'm going to use an alcohol wipe just for, it's been exposed to the air for a while. And remember, with our conversion, we have 500 milligrams per milliliter. Our order is, I'm going to uncap my needle, and again, go in at an angle so I don't pour the top. And I'm going to pull. And if you're having trouble pulling medication, the best thing you can do is make sure you inject enough air in there that matches the amount of drug you need. So I need 2 mils. I'm going to inject 2 milliliters of air. And then I'll flip my medication over.
You have to have a medication to have a medication.
And
By time to get it.
I will get medication, maybe. There we go. And don't worry if it is hard for you. Sometimes it takes a little bit of practice. This is why we practice and do these demonstration videos. And I'm going to recap this needle using the one-handed method. And I'm going to remove this needle. Maybe. And put that in the sharps container. And put the injection needle. Okay. So I'm going to get rid of this, and I'm going to head on down to my patient. All right.
Hello.
Hi, Mr. Furter?
Yes.
Hi. 1 gram, and we're going to do this in your hip, right in the, put you on your side. You'll roll toward me. Okay. Can you verify your name and date of birth for me?
Furter, 3/14/19.
Okay. And Frank, do you have any allergies?
Nope.
Okay. This is just an alcohol wipe, and that's just to clean the area before I give you your injection. Any questions about the procedure?
Nope.
All right. So now I'm going to uncap my needle, and I found my ventrogluteal site. Move the tissue over a little bit. Go straight in, and and then I'm going to let go. And because this is a hot dog, the Ztrack method is a little bit more difficult. But I'm going to do the Z in there to keep it from doing that. Mr. Frankfurter, how you feeling?
Great.
Great. Is there anything else? Really, you?
No, thank you.
All right. Here's your call light. And the doctor should be in shortly. Are we done? Oh, yes. I just wanted to make sure we were done in the room. So now I've got to go, I'm going to wash my hands as I leave the patient's room. And I've got to put in my MAR that I gave Mr. Frankfurter 1 gram of Rocephin, 1,800 hours, and then sign B. Foreman, student nurse. That's it.